Welcome to the American Institute of Healthcare Professionals video on what is trauma-informed care. And in this video, we're going to look at the principles of trauma-informed care and how to actually apply it within a facility or a particular agency. When looking, though, at trauma, we need to have an understanding of what trauma is. And trauma, for the most part, is the result of a severe, stressful life event that created an existential life crisis. The crisis could have been due to a natural disaster, or it could have been done through the violence of another human being. It could be singular in nature, or it could even be collective. It could be something that happened just in one moment, or it could be trauma that is spanning across a lifetime itself. Many types of abuse, though, that we look at within trauma are never spoken about, and it remains something that stays within the person. And in these cases, this is where trauma never is able to be healed. And when it is discovered in the counseling session, it can then be addressed within a therapeutic relationship between the counselor and the victim/survivor. However, not all experiences are the same. So if we look at a trauma event objectively, the subjective experience can be very different. So individuals who might experience a certain event may not have a traumatic reaction. It might be a bad thing that occurred, but it might not be something that leaves a traumatic scar, which can lead later to depression, anxiety, or PTSD. Instead, the person heals naturally, processes the memory properly, and proceeds with life. So when looking at trauma, it's not just the event. We look at the 3 E's: the event, the experience, the subjective experience, and then the effects that followed it. So in trauma-informed care is about discussing trauma within the counseling session, within the counseling therapeutic relationship itself. It looks to identify trauma in the person, whether it's been seen or discussed, or if it happens to manifest through certain signs or effects that trauma has occurred in the past. And a counselor who is trained and certified in trauma-informed care is more attuned to an individual who might have experienced trauma because they are aware that trauma exists. And this is what is very important to emphasize when it comes to trauma-informed care. It emphasizes the 4 key R's in trauma care. And this comes from SAMHSA, the Substance Abuse and Mental Health Service Administration. So all trauma-informed care specialists live by these 3 R's. Number 1, they realize that trauma and abuse exist in this world. It's common, and it is a universal human phenomenon. In fact, 70% of the population experiences some type of trauma. In realizing this, counselors need to recognize, that's the second R, they need to recognize the signs of abuse and trauma in a victim or a survivor. They need to be able to respond as good counselors, social workers, or healthcare providers, or pastoral caregivers. They need to be able to respond in that capacity to give the appropriate aid and help to the victim/survivor, to help them heal in that response, and to find resources moving forward, but also to be able to grant the justice that these survivors need in order to move forward. Finally, re-traumatization is something that is very important in trauma-informed care to avoid. We don't want to re-traumatize an individual through our work. So it needs to be done in a certain way when we are discussing traumatic events with a victim survivor, whether we're using CBT or exposure therapy or talk therapy, whatever we are doing, there are certain ways that we can discuss and look and identify the signs, analyze the emotions, but in such a sensitive way so that re-traumatization does not occur. So there are some important aspects if an agency or a counselor wants to utilize trauma-informed care in their practice or at their agencies. So as we go forward, we want to look at 6 key aspects of trauma-informed care. Number 1, an agency or a counselor needs to have a safe place established and set up for the victim/survivor to be able to tell their story. If there's no safety, if there's no security, a victim or a survivor can feel very uncomfortable and unsafe in even speaking the name of the perpetrator or even speaking about the event itself. Second, there needs to be an establishment of transparency and trust within the organization, not just the counselor, but within the entire organization, and how that trust is manifested in interaction with the victim/survivor. The agency or the counselor needs to be able to supply peer support options for the victim/survivor. Peer support options are an excellent way for individuals who are ready. Not all are ready yet to tell their story, but to find like-minded individuals to be able to discuss how they have coped, how they have gone maybe down dark roads and have finally gotten away and returned back to proper coping methods. So peer support groups are always important. We find that in substance abuse, grief counseling. So anywhere you can find a like mind, that's key. Number 4, the entirety of the agency must make trauma part of their mission, must be part of their essence. So from the receptionist all the way to the counselor to the director, the idea that trauma-informed care is a core principle within this particular mental health agency. It has to be something that is really pounded into everyone, from the lowest level employee to the highest level employee. Number 5, both staff and victim survivors are granted empowerment and choice in the healing and the justice of the victim survivor. So in this way, it's not just a unilateral power construct where the counselor dictates how things are going to go. Instead, the victim survivor, the client, has an important role in determining treatment and determining what steps and how fast or how slow this particular individual experiencing trauma wishes to go. And finally, number 6, there needs to be a removal within the agency, or at least in the counselor's minds, any types of implied bias, a removal of all of these cultural, religious, social, sexual, gender biases that might be based on the victim survivor. The victim survivor could be part of numerous other groups that might not necessarily be the same as the counselor or the agency. And these biases need removed, and the trauma victim needs to be seen simply as a human being, a hurt human being that needs healing and help. So if agencies are looking to implement trauma-informed care, there are some key implementation strategies for any agency, and we listed them here. The first is leadership needs to start the process to get the ball rolling. Leadership needs to implement trauma-informed care at the highest level and allow that idea to trickle down. Written policies and procedures for trauma-informed care need to be supplied to everyone. Third, a physical environment that fosters safety for victims and survivors needs to be created. So that idea of being not seen, being able to enter in, have that feeling of security, that feeling of concealment, not having to worry that what is spoken about is going to be shared across the office, or that it is going to be shared maybe with the perpetrator. An individual already has a lot of fear walking in, telling the story for the first time. They might be under threats. They might fear for their life or their family's life. So they need to feel that this is taken very seriously and that safety is there for them as they tell their story. But also, in addition to that, they feel safe telling the story to a counselor who should be aware that maybe this individual was dismissed prior. Maybe this individual years ago came forward and was dismissed and labeled a liar. And this might also be something that they feel insecure about bringing this up again. So fostering safety is extremely important. Fourth, communication between staff. And by this is meaning that staff needs to be able to communicate properly the needs of particular clients. Now, if there is a general staff, this is not a breach of confidentiality. Sometimes individuals come in and they are collectively seen. Now, this doesn't mean sharing something with the janitor in terms of that staff or the receptionist, but there are many who work together on a collaborative effort in helping people with trauma. And the victim or survivor needs to understand that there is types of collaboration in this. In addition to that, a collaboration between staff just with procuring various policies and ensuring that those policies are followed. Cross collaboration also, not just within the staff itself, but cross collaboration with other agencies for support. So there could be other areas, pastoral, churches, other community centers that are also working with this particular individual and are freed of confidentiality to be able to share, or can be referred to. So a client could be referred to this individual because the resources are present in this regard. Number 6 is a utilization of the best empirically based formulas for screening, assessing, and treating those with trauma. And this comes from the highest levels, but also the most well-trained licensed professional counselors, licensed social workers, psychologists, psychiatrists that are on staff to determine what are the best methodologies and treatments to follow, and then to ensure that these treatments, methodologies, screening processes are applied at every level in itself. And this comes to the 7th point, training in workforce development in trauma-informed care. So having CE courses or having presentations where special training is done for all staff. And by that, even those who are lower tier level mental health professionals, as well as maybe even the staff itself that works at the front desk. We want everyone within the agency to have some understanding of trauma and how a client might react negatively in a counseling session so that everyone understands how to help calm individuals down in itself. 8th, there should be a quality assurance of the implementation of these policies, training, and programs, sort of a project manager to ensure this. And within that, number 9, there should be an evaluation and feedback protocols that are done with this. So various counselors who are working with those who deal with trauma are able to give their feedback to the higher levels of management to see how the protocols are working, what needs ironed out, what's good, what's bad, what could be done better. Finally, there needs to be the financial element and the budget to ensure that the various trainings are paid for, the certifications are paid for, the materials that are handed out are paid for. So it's from a top to bottom implementation to ensure that trauma-informed care is working best within your particular agency itself. So that's a little bit about what trauma-informed care is, important aspects of it, and how it can be implemented in counseling and also at a overall organizational structure. We are the American Institute of Healthcare Professionals, and below is our behavioral health certification link. We will be offering also a trauma-informed care certification. Our phone number is 330-652-7776, and our email is info@aihcp.org. I'd like to thank you for listening and have a good day.